This conference will now be recorded.
Okay. Okay, today's topic is adenomatous polyp, otherwise known as endometrial polyp in uterus. So whenever you see the term adeno like thing, so what is adenoma? Adenoma is a tumor arising from the glandular structures. So adenomatous polyp means it is the polyp which contains gland-like structures. So in uterus, where are these glands? These glands are present within the endometrium. So adenomatous polyp, otherwise known as endometrial polyp. So what's the definition of endometrial polyp? Endometrial polyps are benign, localized overgrowth of endometrial glands and stroma covered by epithelium projecting above the adjacent epithelium. So they consist of epithelial and stromal components as we seen in the endometrium. These are polypoid growths projecting into the uterine lumen. So before going into the topic, I want to discuss the microscopy, normal histology of uterus. This is the normal histology of uterus, and this is the uterine lumen, and this is the endometrium followed by myometrium, which is divided into perimetrium and stratum vasculosa and outer serosa. So this is the endometrium. So these are the gland-like structures we can see in the endometrium, and surrounding to these glands is the stroma. So endometrium contains both glandular as well as stromal components. So endometrium is again divided into functionalis and basalis. Functionalis usually contains gland-like structures. Basalis is little bit, glands are little bit compared to the functionalis. There are less glands in the basalis. Okay, and this is the hyperview of the endometrium. So the endometrium is lined by the tall columnar epithelium, and the this stroma is densely packed and contains various glands, and these are the endometrial glands. Okay, so based upon the action of various hormones, endometrium is divided into proliferative endometrium as well as secretory endometrium. Proliferative endometrium we can see in proliferative phase of the cycle by the action of hormone estrogen. So in case of proliferative endometrium, these glands are, there will be increased gland to stromal ratio. So these glands are getting proliferated and there will be increased gland to stromal ratio with compact stroma in between the glands. Whereas in case of secretory endometrium and in case of proliferative endometrium, these glands are short, tubular and with a narrow lumen. But in case of secretory endometrium, these glands are enlarged with the lumen containing secretions, as well as these glands are coiled, not tubular or narrow. The glands in the secretory endometrium are coiled and the surrounding stroma is less cellular and edematous. So these are the two differences between proliferative endometrium as well as secretory endometrium. Proliferative endometrium seen in the initial proliferative phase of the cycle, and secretory endometrium seen in the late phase of the cycle. Uh, uh, okay, so now coming to the topic. Endometrial polyps are benign, localized overgrowth of endometrial glands and stroma covered by epithelium projecting above the adjacent epithelium. They consist of epithelial and stromal components. So these polyps also contain both epithelial as well as stromal components, as in case of normal endometrium. And these are polypoid growths projecting into the uterine lumen. So these are the polypoid growths which are arising from the endometrium and are projecting into the uterine lumen. There may be single or multiple and are usually sessile, measuring from 0.5 to 3 centimeter in diameter, and they are occasionally large and pedunculated, and the polyps may be asymptomatic or may cause abnormal bleeding. They are most commonly located on the fundus. They may protrude into the vagina and may cause bleeding. Although endometrial polyps may occur at any age, they most commonly are detected around the time of menopause. They may present as abnormal uterine bleeding and they may turn into neoplastic. So that's why it is very important to surgically dissect the polyp, because it may turn into neoplastic, it may undergo neoplastic changes anywhere in the time. So what is the classification of endometrial polyps? Most of them are either hyperplastic, atrophic, or functional. So hyperplastic polyp, what is meant by hyperplastic polyp? If the polyp contains more number of glands compared to the stroma, as in case of hyperplasia of endometrium, so it is known as hyperplastic polyp. So it resembles diffuse non-polypoid endometrial hyperplasia. They are responsive to estrogen because with estrogen there will be endometrial hyperplasia. That's why hyperplastic polyps also respond to estrogen but show little or no response to progesterone. So coming to atrophic polyp, they are seen typically in postmenopausal patients. They contain cystically dilated glands lined by low columnar or cuboidal cells. And functional polyp, they resemble normal cycling endometrium and they demonstrate secretory changes of the endometrium. So these functional polyps contain secretory type of endometrial glands surrounded by edematous stroma. Whenever we can see the polyp containing secretory type of glands, we can call it as functional polyp. And one entity, that is tamoxifen related polyp. So tamoxifen is the anti-cancerous agent used in the therapy of breast cancer. It has anti-estrogenic activity on the breast and it has weak pro-estrogenic effect in the endometrium. So that's why it can cause endometrial polyp. So these are large, and the most characteristic finding in tamoxifen related polyps are these are large, sessile with honeycomb appearance. So coming to clinical features, small polyps are usually asymptomatic and large polyps are associated with abnormal uterine bleeding and occasionally infertility. Rarely, giant polyps may fill the uterine cavity and extend into the endocervical canal, generally unresponsive to progesterone stimulation, and these are responsive to estrogen. Polyps associated with tamoxifen therapy are characteristically multiple, large, and fibrotic. So coming to the morphology, grossly these are single or multiple, usually sessile and small, usually 0.5 to 3 centimeter in diameter, but occasionally they are large and pedunculated. So this is the beautiful picture given in Ackerman. So this is large endometrial polyp filling the entire endometrial cavity, and this is the small endocervical polyp projecting from the squamocolumnar junction in the cervix. So, and this is the subserosal leiomyoma. Okay, and this is the small polyp arising from the fundus part of the uterus. So histologically, these are polypoid structures arising from the endometrium lined by epithelium on three sides. So this is a polypoid structure lined by epithelium on three sides. This is one side, this is one side, this is another side, and this is another side. So all the three sides are covered by the endometrial lining, which that is superficial epithelium, that is tall columnar epithelium. And these are essentially made up of endometrial glands and stroma. So the glands are usually endometrioid in type, not cervical type. These are endometrioid in type and is of three types. If the glands are inactive, if the glands within the polyp are inactive, we call it as atrophic polyp. And usually these glands are cystically dilated and are lined by the low columnar to cuboidal to low columnar epithelium. And in case of proliferative polyp, that is the polyp contains more number of glands compared to that of stroma, as in case of hyperplasia of endometrium. So that is proliferative, and another one is secretory. When we see the secretory type of glands within the polyp-like structure, we call it as functional polyp. So coming to the stroma. Stroma in polyp is less cellular and more fibrous compared to normal endometrium. And it also contains thick walled blood vessels. So this is the polypoid structure, which is covered by the epithelium on three sides, which is that surface epithelium is the tall columnar epithelium, and underlying to that epithelium is the stroma as well as glandular component. So we can see various glands. Some of them are normal, and some of them are cystically dilated. And there are occasionally thick walled blood vessels. We can see here thick walled blood vessels. And surrounding stroma is less cellular compared to the normal endometrium and more fibrous. This is the hyper overview of a polyp, showing cystically dilated glands as well as normal glands, and the surrounding stroma is fibrous. Surrounding stroma is fibrous and contains thick walled blood vessels. So these are cystically dilated glands, usually seen in atrophic endometrial polyp. This is the gross picture in a lab. So this is the abdominal hysterectomy with bilateral salpingo-oophorectomy specimen. The cut open section shows two polypoid structures which are probably arising from the endometrium. So this is the notes of the specimen. This is the specimen of total abdominal hysterectomy with bilateral salpingo-oophorectomy measuring 9 into 7 into 3 centimeters. Cut section shows two polypoid structures, each measuring 3 into 1.5 centimeter, arising from the endometrium and fully occupying the endometrial cavity. So we need to differentiate between these endometrial polyps to that of submucosal leiomyomas. How we can differentiate? So these endometrial polyps usually contains peduncle, pedicel, and these are polypoid structures. Some of them are large and they occupy the uterine cavity, as we can see in the case of submucosal leiomyoma. So in that case, we need to differentiate only from the microscopic findings. Okay, usually these are small and pedunculated polypoid structures. So this is the notes. You can take the screenshot of these notes. In your Harshman, you don't find all these pictures, so try to take screenshot or something else. So this is the end of the session. You may leave.